Listen very closely, because the sounds your body makes after the age of 60 are rarely just a coincidence. They are actually a sophisticated early warning system that most people overlook. Not because they are careless, but because no one ever told them what to listen for. By the time this video ends, you will never hear your body the same way again. I am Dr. Wyatt Sterling, and I have been practicing as a specialized surgeon for almost 3 decades, witnessing firsthand how a simple ignored noise can evolve into a significant medical challenge that becomes far more difficult, and sometimes impossible, to fully reverse. Before we dive into these critical signals, I want to know who I am speaking with today, so please drop a comment below and tell me from where you are watching this video right now. We are about to uncover 5 specific sounds that deserve your immediate attention. I have ranked them carefully, and the last one on this list is so deceptive, so easy to dismiss, that recognizing it has genuinely changed outcomes for patients I have seen in my own practice. Most seniors dismiss these noises as the inevitable rust of aging. But here is what I have learned after 3 decades in surgery. A quiet body is often a sign of efficiency, and a body that suddenly starts making new sounds is almost always trying to tell you something urgent. Do not ignore it. The first sound is one that tends to appear at night, in the silence, when everything else has gone still. Imagine lying in your quiet bedroom and suddenly hearing a rhythmic, pulsing whoosh inside your ear, a sound that seems to sync up perfectly with the beat of your own heart. Most people assume it is congestion. Some think it is stress. They wait a few days, it seems to fade, and they forget about it entirely. That is the most dangerous response you can have to this particular sound. From a clinical perspective, this pulsing is often the acoustic signature of blood turbulence, fluid encountering resistance as it moves through your carotid artery toward the brain. When the smooth, silent flow of blood is interrupted, the friction against the arterial walls creates this internal echo. It is the same principle as water pressure dropping in an old pipe. The pipe does not fail silently. It tells you first. And this sound is your body telling you first. What concerns me most as a surgeon is not the patients who come in with obvious symptoms like numbness or sudden headaches. It is the patients who heard the whooshing weeks earlier and waited. Early intervention in vascular issues is not just preferable. In many cases, it is the difference between a full recovery and a permanent deficit. If you hear this pulsing tonight, do not wait for more obvious symptoms to arrive. Contact your healthcare provider and specifically mention the phrase pulsatile tinnitus. Those 2 words will communicate exactly what needs to be investigated. Stay with me, because the second sound is one you have almost certainly already heard, and what it actually means is not what most people think. The second sound is one you likely hear every morning the moment you step out of bed. A sharp, repetitive pop, or a gritty, grinding sensation deep within your knees, hips, or ankles. While occasional cracking is common in younger years, a persistent grinding sound after 60 carries a different meaning entirely. What you are hearing is the structural conversation between bones whose protective cushioning has significantly thinned. This is not just a comfort issue. This bone-on-bone interaction triggers inflammatory responses that researchers have increasingly linked to systemic stress, including cardiovascular strain. Your joints are not just complaining about local wear. They are signaling that a degenerative process is already in motion. Here is what most people do not realize. The grinding you hear today is almost always preceded by a quieter, softer version of the same sound that went unnoticed months or even years earlier. Which means, by the time it becomes audible and consistent, the process has already been progressing for some time. The people who address this early, who take the grinding seriously before it becomes daily pain, consistently maintain their independence and mobility for significantly longer, not because they found a miracle solution, but because they listened before the damage compounded beyond what conservative management could address. Every time you dismiss that sound as normal aging, you may be allowing a process to accelerate that did not have to. Your skeletal system is sending an audible warning. The question is whether you are treating it as information or background noise. Now, the next sound on this list is one that happens while you are asleep, which means many of you have no idea it is happening at all, and that is precisely what makes it so dangerous. Moving to the third sound, we encounter something that usually happens in the middle of the night, a sudden violent gasp or an explosive snort that jolts you or your partner out of deep sleep. Many people who experience this assume it is simply heavy snoring and think nothing more of it. But in clinical practice, this sound represents something far more serious. This is often the audible evidence of an obstructive event, a moment where your body's oxygen intake has been temporarily but significantly interrupted. The gasp is not random. It is your brain's emergency response to falling oxygen levels, forcing a desperate inhalation to protect your heart and your brain from the physiological stress of a restricted airway. And here is what makes this particularly concerning for people over 60. This cycle, obstruction, oxygen drop, emergency gasp, brief recovery, obstruction again, can repeat dozens of times per hour throughout the entire night, every night, for years. The cardiovascular burden this places on your heart during what should be its rest period is enormous. It is the equivalent of asking someone to run short sprints repeatedly for 8 hours and calling it sleep. Patients who have had this condition undiagnosed for years consistently show elevated blood pressure, reduced cognitive sharpness, and higher inflammatory markers, all of which are compounding risk factors for stroke and cardiac events. If you find yourself waking up breathless, if you feel unrefreshed despite a full night of sleep, or if a partner or family member has mentioned these sounds, treat it as a medical signal. A sleep study is a non-invasive, straightforward investigation that has genuinely changed the health trajectory of patients I have referred over the years. I want to make sure you stay for the final two, because number 4 is one most people brush off as a digestive inconvenience, and number 5 is the one that concerns me the most. It is the quietest sound on this list, and it is the one most likely to be dismissed entirely. The fourth sound is one that originates in the abdomen, and it is not the familiar low rumble of a hungry stomach. What I am describing is a high-pitched, almost metallic tinkling sound that seems to ripple through your gut, often accompanied by a sense of fullness or mild cramping that does not resolve the way typical indigestion does. After 60, digestive motility changes. This is well established. But this specific acoustic signature is different from the normal sounds of a working digestive system. It is created when liquid and gas are being forced through a restricted or narrowing space under pressure. The intestinal tract is essentially telling you that something is obstructing the natural flow of its contents. Most people reach for antacids. They adjust their diet. They wait it out. And for some, the sound fades temporarily, and they conclude it was nothing. But a persistently high-pitched gut sound, particularly when it is new, when it is recurring, and when it is accompanied by any change in your normal digestive patterns, is a clinical red flag that warrants professional evaluation. Not because it is always serious, but because the conditions it can indicate, if caught early, are highly manageable, and if left until more dramatic symptoms emerge, they are significantly less so. If your stomach starts sounding more like a pressurized pipe than its usual self, that change in sound is worth one conversation with your doctor. And now the fifth sound, E, the one I have been deliberately saving. Because of everything I have covered today, this is the one that is most frequently dismissed, most frequently misattributed, and in my clinical experience, most frequently regretted when it is ignored too long. The fifth and most deceptive sound is a small, seemingly innocent click or snap that occurs right at the hinge of your jaw, when you chew, when you yawn widely, or sometimes simply when you open your mouth to speak. Most people attribute this immediately to a dental issue or a stiff joint. They mention it to no one. They adapt their chewing. They move on. For those over 60, this sound occasionally carries a completely different significance. It can be the only audible symptom of temporal arteritis, an inflammation of the vessels running near your temples that, if unmanaged, can escalate to affect blood supply in ways that produce sudden and sometimes irreversible changes to vision. I want to be precise here. Jaw clicking alone is not a diagnosis. Most jaw clicking is benign, but jaw clicking that is new, that is accompanied by any tenderness along your temples, any unusual headache pattern, or any even momentary visual disturbance, that specific combination is a clinical red flag that needs to be evaluated promptly. The reason I place this last is not because it is the most common. It is because the gap between the sound appearing and people taking it seriously is often dangerously wide. The sound is too small, too easy to explain away, and the potential consequence of explaining it away incorrectly is significant enough that I want it to be the thing you remember most from this video. You have spent decades building your life and everything that matters to you. These 5 sounds are not the inevitable soundtrack of getting older. They are the language your body uses when it needs your attention. Specific, purposeful, and often early enough that action still makes a real difference. I want you to make a commitment today, not to alarm, not to anxiety, but to awareness. Your health is your most valuable asset, and early detection has changed outcomes for more patients than any surgical intervention I have ever performed. Share this video with someone you care about, because these sounds are often noticed by a spouse, a child, or a friend, before the person experiencing them takes them seriously. Your awareness today could be the most important thing you do for someone you love this week.